Hi, I'm Holly DeMarsh. I'm the supervisor of the Family Birth Center. Today I'm just going to give you a tour of our Family Birth Center. So when you come in the hospital, this is the entrance that you'll see. And so you'll buzz the door in to get into the unit. You'll buzz in there, and then somebody will let us in. And either our unit can let you in, or so can our comm center, which is another location in the hospital. Thank you. When you come in the unit, if you're coming into the labor side, you'll walk down the left side of the hall, but if you're going down the postpartum side, you go to the right. Our unit is a full circle, so we'll just start with the postpartum side, and we'll continue down the hallway. We have several rooms in the building. The first room here is actually an outpatient room. It's being used right now, but that room is used when patients come back with their babies for family or for weight and color check, or possibly for lactation help, which that both are done on a postpartum aspect after they discharge from the hospital. So if you continue down, we have 7 rooms in our unit. The 7th room is a shared unit with med-surg, and then we have 6 labor rooms. We have 2 queen-size beds, and the rest of the beds that we have are singles. So we're going to take you into a room that has a, sorry, walking backwards, I want to be careful not to hit anything. So we're going to take you into a postpartum room that has a queen bed right now, and that's room 2 and 3. So we're going to go into room 2 in just a minute. And our postpartum rooms are all exactly the same, except for room 6 has a shower in it. And so technically, if patients have a C-section, we like to put them in that room just because of the shower. Okay, if you go into the postpartum room here, I'll have Melissa just kind of scan the room. All the rooms are identical except for, like I said, the queen size bed and or a single bed. So we have 2 rooms that have a queen size bed. Everything that you need on a postpartum side is in here. Babies have their bassinets. They come in after delivery, come to the postpartum room. We keep the babies in the rooms with the families as much as we possibly can. If a family needs some sleep, we can take the babies out to the nursery, which we'll show you here in just a little bit. Otherwise, for the most part, babies do stay with the families in the postpartum rooms. And then everything that you need on this side of the hall is here for you. The bathrooms, we'll have her just show you the bathrooms again. They're all pretty much the same. Have a tub, shower, and a bathroom, and or a sink. The couch here does pull out for sleeping. Not the most comfortable, but it does pull out, and we can make that into a bed. And then the recliner also reclines. So next, we're just going to move down through the hall. The next thing we come to is our nutrition center, and this is just for families. There's not a ton of food and supplies here, but there's in the fridge, there's some drinks, some bread, Jello, popsicles, things like that. Then there's a water machine, coffee machine, microwave, and toaster. There's some soup, crackers, things like that. Then we have 3 labor rooms. All 3 labor rooms are identical, except for labor C has a shower in it as well. So then we're just going to take you into labor B. I'll have Melissa scan the labor room while we're in here too. This back part is resuscitation center. So women labor in this room. They deliver babies in this room. If we need anything for babies resuscitation wise, babies can come over here. We can do weights. We can do measurements of babes in this back nursery area. Anything that we need for the docs for delivery is in this little closet, and same thing with resuscitation. Anything we would need for babies is in this closet. So once the woman delivers on this side of the unit, she's in this room for approximately 2 hours after delivery, and then we do move them over to a postpartum room. These rooms also have bathrooms. They're the same as the other rooms, has a shower, toilet, and a sink. And then everything we need in here for monitoring, the woman for fetal monitoring, and for if they need any oxygen or have IVs and things like that, everything is already in this room for us and ready for to take care of her during the delivery process. And here's the bathroom again. Women can labor in the tubs if they want. There's plenty of space for support people to be in this bathroom with her as well. Next, we're just going to proceed down the hallway and show you a few other aspects of our unit. We have one more labor room, which is labor A, and then we have our nurses station, which is going to be here on my right. And then we have our nursery. We're just going to go into the nursery. This nursery is used primarily to bring babies out every single night between 11 p.m., 1 a.m., somewhere in there. We like to bring our infants out to the nursery, get their weight, do some other testing that's required. Some things that we do are hearing screens. We do a TCB test, which is a little probe on their forehead that tests for their bilirubin or the yellowing in their skin. We do a congenital heart defect test called it's what's called CCHD. We do that after 24 hours. Babies have a newborn screen that's done prior to discharge, usually between the 24th hour and the 48th hour. That's done in the back nursery. So babies will come out for those types of testing. Parents are welcome to come out with their big children, the babies, if they want. So I'm just going to show you the back nursery. That's called a procedure nursery. If a baby would need more assistance with resuscitation, we would bring the baby back here. It's easier for our radiology staff to come in to this room to do x-rays. We can have more people around the warmer if needed, if babies needed more assistance. Also on the counter, baby would have their, if it's a boy, babies would have their circumcisions done in this room by the provider. And so we have all the equipment that we need to further assist infants if they need it. There's also a family room, so we're just going to go back out the nursery to show you where there's a family room. So coming down this hall, kind of finish the loop of our unit, and there's a family room right off to my left here. And this room has TV, computer, I believe there's a telephone, yes, in this room, and some chairs and tables just for extended family to be comfortable while they're waiting. All right, so finishing the loop, we end back at our entrance. So we only have one entrance into our unit, and it's a locked unit. If you guys would have any questions, please feel free to give us a call. My personal number is 715-233-7636. Please watch this video once you're done. Think of any questions that you may have, and I would be glad to sit down with you and answer any other questions you may have. Thank you. We look forward to seeing you.